In this video, we are going to show you how to do a clinical examination for a woman in postpartum care. Prepare the equipments, gloves, Dynamab machine, clean perineal pad, and pen light. Maintain the privacy. Wash and warm your hands. Welcome the woman, addressing her by name and introduce yourself by name and job title. Explain the procedure, the information it provides, and what it might feel like. Ask the woman when she last voided. Ask her to void before starting examination if it has been longer than 1 hour. A full bladder displaces the uterus, making it feel high and deviated to one side on palpation. Check the vital signs. To provide database for diagnosis of complication. Ask the woman to lie flat in bed with her head on a pillow. Put her arm down to her side. Place the mother in a supine position with her knees slightly flexed. This relaxes the abdominal muscles and permits accurate location of the fundus. Examine the breast. Inspect the breasts for size, contour, asymmetry, engorgement, or erythema. Check the nipples for cracks, redness, fissures, or bleeding, and note whether they are erect, flat, or inverted. Palpate the breasts lightly if they are soft, filling, or engorged. Any discharge from the nipple should be described and documented if it is not colostrum, cream yellow, or for milk, bluish white. Assess the uterine fundus. Inspect the abdomen for any scars or umbilical hernia. Place one hand on the lower segment of the uterus for support. Use the side of the other hand to palpate the abdomen and to locating the top of the fundus. Determine the consistency of the fundus, firm, soft, or boggy. A boggy or relaxed uterus that has not contracted down well is the main cause of postpartum hemorrhage. Measure the level of the fundus in finger breadths, above, at, or below the umbilicus, to determine the involution rate. Determine the position of the fundus in relation to the midline of the body. If it is not in the midline, locate it and then evaluate the bladder for distension. Assess the lochia and inspect the perineum. Lower the primal pad and observe the amount, color, odor, and type of lochia, and whether there were any clots passed. To provide a database to differentiate between lochia of normal involution and discharge, and if there are any signs of infection or hemorrhage. Ask the woman to turn onto her side with her upper leg unhypoflexed, left upper buttock, to expose the perineum and anus. Observe perineum for the following: source of bleeding and episiotomy or laceration. Assess perineal area for rheda, redness, ecchymosis, edema, discharge, and approximation. To evaluate the episiotomy healing. Assess for hemorrhoids. Provide the mother with a clean pads. Romance test. Examine lower extremities sensation and abulation. Perform foot dorsiflexion to assess for deep vein thrombosis. Discard equipment properly and wash hand. Ask the mother about bladder and bowel function. For the bladder, 2 or 3 voidings should be measured after birth or the removal of a catheter to determine whether normal bladder function has returned. A full bladder prevents the contraction and normal involution for the uterus, which lead to postpartum hemorrhage. Bowel movement may not occur for 2 to 3 days after giving birth. Ask the woman to see if she has had a bowel movement or has passed gas since giving birth is important. Explain findings to the mother and document.